So first up on the videos, we're going to do the waist to hip ratio. And for the lack of a better tool, I have a band here. We would normally use a circular measuring tool to use to measure the hips and waist. So you just bring it around, go right above the hips, right above your iliac crest, and pull it tight. And then you would read a number, whatever the number would see right through here. You would read that across your waist. And then for the hips, go right in line like so. And you would also read that number wherever you have it placed at. And then you take those two numbers, and those are your waist to hip ratio. Okay, and so for next, we're going to do what we call demonstrate the anatomical position. The anatomical position is just facing forward, palms facing out. That's the key component here. Palms are facing out. This is the anatomical position. That's what we use in all of our anatomy classes. This is to give everybody a broad point of view of how to view the body. Just keeps everything simple. And so we have some terms that we have to go over for the anatomical position. First of all, superior and inferior. So the easy way to remember superior is just above, inferior below. So we could say, for example, the head is superior to the shoulders, or your knee is superior to your feet, and vice versa. Your hands are inferior to your shoulders, or your feet are inferior to your hips. And then next we have medial and lateral. So medial and lateral, medial means middle, so it's more towards your line of your body, which we'll get into in a minute. Then lateral is the further point of your body, so on the outside. So you'd say the easy way to break it down for me is through your arm. So just do your arm in one section. So shoulder, elbow, hand. So from your shoulder, their medial is your elbow. Your elbow is medial to your shoulder. Your hand is distal. Distal means further away. So let's see. So then we have medial and distal. So then we have, or proximal and distal. Sorry, excuse me, got it all backwards here. Medial and lateral. So medial is just closer to your midline, and lateral would be further away from the midline of your body. So all the way through here. So proximal and distal, that's where we're talking about the single arm here. So proximal is closer to your point of attachment, and distal is further away. Kind of self-explanatory to distal. So again, with your shoulder, your elbow would be proximal to your shoulder, and your phalanges, your hand, would be distal to your shoulder. So it's further away from the point. And then we have superficial and deep. So superficial and deep is almost self-explanatory by the word itself. Superficial is anything on the outskirts, so outside of the body. So your skin, your nails, your hair, facial hair, ears are all superficial to just, for instance, your rib cage or any of your internal organs. All of those are deep. Your brain is deep to your cranium. And that's pretty much all there is to that. All right. So next, tool here. Next, we're going to talk about the planes on the body. So this is just a pretty demonstration of how, if you could imagine a line going through your body. So the first line we have is the sagittal line. So sagittal would go right here, straight down the middle through the sternum, all the way up, all the way down. If you could imagine a one line through the entire half the body, splits it into left and right halves of the body. So movements on the sagittal line are your flexion and extension. So flexion, bringing it closer to you, extension, and then hyperextension, going beyond the point. And then dorsiflexion, you can't really see my feet right now, but dorsiflexion, so if your foot is like this plane, dorsiflexion, you bring it up closer to your shin, and then plantar flexion is going down. So when you do calf raises, you go into plantar flexion. It's like that. Dorsiflexion, plantar flexion. And so that is the sagittal plane. So next we have the frontal plane. This was kind of confusing, especially just demonstrating it. So imagine you have a line running through your body, like all the way through. So there's a line right here, and that cuts it into posterior or anterior and posterior. So this emblem on my shirt is posterior. My nose, your face is on the posterior or the front side of your body. And then where you keep your wallet, and then just the back side of the shirt with the emblem on there, that's all the posterior side. Your butt is on the posterior side of your body. And on that plane, on your frontal plane, we have a couple movements. We have abduction, which is, so we have abduction, which is going away from the body. So abduct, this. Then we have adduct, which means that, well, the easy way to remember it is adduction. You're bringing it closer to your body. You're adding more parts to your body. Same go for your legs. So you have your legs go abduct and then adduct. Then we have elevation of the scapula. So your scapula in the back, both blades. Just shoulder shrugs. So elevation and then depression. Depression would be down. So elevate, depress. Okay, so let's see what we have next. And we have eversion and inversion. Again, it's hard to see my feet, so eversion is more of an outward position, so you're everting out, and inversion is coming in, so you invert. So invert and then evert. So that's all for the frontal plane. And the last plane we have is the transverse plane. So tiptoes. The transverse plane just cuts your body into upper and lower half. So you just have a line going right here at your midsection, and you have your superior half and inferior half. And a few movements on this is this allows you to rotate. Let's see. So you have, let's see where I'm at here, lost my train. So you'll have rotations this way, rotations that way, and then a lot of rehab for your shoulders. You have what you call internal rotate, so you bring it to you. Then you have external rotate, so you start perpendicular here, internal, and then external is going out. So external, internal. And then you have protraction and retraction. So this is of the scap. So protraction, reaching forward. So your scapula is protracting. They are wide. And then retraction is you bring them back. And your scapulas are closer together. So retraction. And of course we have pronation and supination. Pronation is inward. So again, from the feet point of view, if you can see it, or I guess I could do it with my arms, is you pronate your forearm. So you pronate in. And supination, like carrying a bowl of soup. Best advice I got from a teacher is supination, soup, carrying a bowl of soup. You carry it like this, you wouldn't carry soup like that. So supination, pronation. And then we have our axis. So you have your mediolateral. So you have your axes are where your lines point through. So you have mediolateral would be a line horizontally like this. So my rib is medial and my elbow is lateral. It's further away from the line. And you have anterior, posterior. So that would just go straight through. I'll put it this way. So it would be a line that would go straight through. So you have anterior side, chest side, anterior, back side, posterior. So that's just kind of self-explanatory. And then the superior and inferior axis. So that's again the line going straight up and down. So anything like above. So it's a good demonstration on this stick right here. Anything above the white line up here is your superior axis. It passes up on the superior side. Anything below the white line is the inferior. And so what we'll talk about next is the center of mass. So your center of mass is where it's almost like take all three lines, this one, so take your transverse, this one, and this one. So all 3 points right around your midsection is your center of mass. It allows you to move back and forth. And we also have, of course, we're human, so we don't just move like robots. We don't just move one section at a time. We can rotate. We can move in all kinds of different planes. So we have movement in multiple planes. And so our first one is circumduction. Circumduction is, it kind of sounds like the word circle. So you can rotate your arms all the way through. So that's circumduction. And then next we have pronation of the ankle, supination of the ankle. So you can't really see, bad video, you can't get the whole body in there. I can try, but not really. So your pronation of your ankle would be inward, right? So you would go into more of a plantar flexion, slightly inward, coming in to the body. And then the supination of the ankle, you'd go more in a dorsiflexion and away from your body. So those would be movements in multiple planes. So switching gears here, now we're talking about skills. So you have closed skills and you have open skills. So just right off the bat, an example of a closed skill would be taking a penalty kick in soccer. You have the ball is the same height and the same weight, doesn't change, it's a standard ball. You have the goal for soccer, it doesn't change, the dimensions of it are the same, and you always place the ball in the same spot to do the penalty kick. So that's more of a closed skill. So nothing changes. You can't change anything about the variables. It just goes through the motion, and that's that. So an open skill is one that, of course, if a closed skill means you can't change, open skills means you can change. So for an open skill, my example is passing the football, a pass play in football. So that you have slant routes, go routes, post routes, all kinds of different routes you run. So they're different routes for each. Not every throw is going to be the same. So you have to, the pressure coming from the defense, you have to change the way you run, change your route, and the quarterback has to adjust to it. So it changes. You have to be able to change with the variables outside of your body in order to complete the motion. And so that's kind of a gist of what an open skill and closed skill are. So next we have 3 different skills, and we have discrete, continuous, and serial skill. So a discrete is strictly like A to B. So my biggest one that I could think of just stood out right off the bat, if it's just from point A to point B, is a deadlift. So you go down, you pick up. So you go down, pick up the weight, press it up, press it down. So you go from point A, point B, back to point A. Simple as that. So next we have continuous skills. And that's kind of like, again, self-explanatory, continuous. So it means a motion that will continue to go on and on and on. So you can say going for a bike ride, the pedaling on the bike. It's a continuous skill. Or rowing. Rowing is just a continuous skill. And then serial skill is kind of like a mix between serial skill and discrete. It doesn't always change. There are certain motions to it, but there's more to it than just A to B. And so for my example for that is a place kick in football. So it's A to B because you want to get the ball into the goal. A, B. But you have to move one fluid motion and come through and kick. So that motion of running through and kicking lets it know that you have to kind of adjust and be more open to the different movements of the body. It's not just walking up to it, kick the ball. There's more motions going through it. So those are our 3 skills. Then we have our simple and complex kinetic chains. What does that mean? Kinetic chain, what's a kinetic chain? So kinetic chains are just movements that are bound together. So not, when you move your arm, you're moving more than what you think. There are more muscles and more ligaments than you think moving at one time. So an example for a simple kinetic chain is it only moves like a hinge movement. So I think of leg extensions. You're on the machine for leg extensions, you just press out, maybe press back, press out, press back. Just a hinge movement. And if we're more of a complex, you could say a bent over row. Not only are you engaging your back, you're engaging your arms and your chest. So there's more than one variable. Your arms come up, your scapula contracts, your chest contracts. Like everything is a big movement, all in one press. Just more than just one kinetic chain. And we also have closed and open kinetic chains. So you have your simple and your complex. So you have a simple just lift or whatever, then everything builds on it and becomes more complex. We're complex creatures, we don't just do anything simple. So example for a open kinetic chain is a dumbbell chest fly. You bring your dumbbells out and you do a chest fly. So there's more engaged of the forearms, the biceps, the shoulder, the chest. And then we have for a closed would be standing calf raises. So literally you just stand there and go up and down. So that's A to B, A, B, A, B. There's no other movements. There's nothing else going on. You're not using your arms. You're really not even using all the muscles in your legs. Strictly just raise up, raise down. Or raise up, go down.